And welcome back to Full Circle with Joyce. But as you can see, my name is Frederick. I'm holding in for Joyce. It's always good to take a break. She's on a break. And right about time, we have Dr. Kireki in the house. Some of the questions that are coming through, Daktari. Hi, Dr. Kireki. How long should one try to conceive before seeing a doctor?
1 year.
1 year.
Should be 1 year. Again, with a small caveat that age is also a factor. So if you're 35 or slightly higher, then try for 6 months. If it doesn't work, then you need to come and see Daktari.
Okay. The other question, after removing my 5-year implant, after a year, 2 months now, not yet pregnant. Why?
There could be different reasons. We don't know how old she is, first of all. So for example, if she put the coil when the implant, when she was 30, she's already 35, and there's already 1 year, 2 months. So she's 36 and 2 months. So we don't know whether the what you call the ovarian reserve has decreased. So we need to find out exactly what is happening. She needs to do a blood test to look at her hormone levels, especially one that tells us about her ovarian reserve. We need to check her thyroid gland, a very important gland as well.
What does it do?
It actually acts like a manager, let's put it that way, of the other hormones in the body. So if the thyroid, yes. So if the levels of the thyroid gland are high or they are low, they are going to affect the way the body behaves. And they will also affect the reproduction system. So we need to look at that as well. We also need to do other tests. We need to test and check whether her tubes are okay, and also look at her womb as well. So I think a proper diagnosis will help us to find out what exactly is happening with her, and then how we can help her. Her husband as well, or her partner. We also need to remember 40%.
40%.
Yes.
It's quite a high percentage.
It is a high percentage. And then the other thing, as I said, is issue about perception. Women are more taunted and say, why are you not getting pregnant? Because they are the ones who actually manifest, the hard work that has been going on behind closed doors. But men, we don't.
You're funny. All right.
You don't, yeah.
Men do
so
not.
A comprehensive diagnosis is important before we can really tell her what the problem is and how we can solve it.
Talk to us on 111 444 111, some of the SMSs. Please talk about fertility drugs. A lot of ladies take pills when they want to get twins or triplets. Do these drugs have any effect on the ladies?
Now, when you talk about fertility drugs, I'm not very sure exactly what they're talking about. But in general, when we are trying to help a lady, to conceive, for whatever reasons, sometimes we do actually give them these, what you call ovulation enhancing drugs, such that because normally a lady produces 1 egg every month. So if we want her to produce maybe 2, maybe 3, depending again on her age and the status of her ovaries, we can actually give her some medications. And then this increases the chances of her having 2, maybe 3 eggs, as it were. And then we can advise her to go and have either intercourse if everything is okay, or even do what is called IUI, and so on and so forth. Yes, these drugs, when taking them, they do increase the chances of having twins. But again, it depends on how many, what you call follicles. A follicle is what carries an egg. How many follicles are there? The more follicles there are, the higher the chances of having, multiple pregnancies, as it were.
I keep hearing about age.
Yes.
And I'm thinking, could our forefathers have learned the same, and that's why girls were getting married so early?
Very, very possible. But then here we have cultural influence as well. Because even now there are some societies where as soon as a girl starts having her periods around 13, 14, she starts producing breasts, she's ready for marriage. Maybe, yes, it is possible that as soon as the periods start, you are actually wife material, you are ready to start your family, you are off to get married. Maybe there could have been something. Maybe there could have been something. Maybe.
Okay. There's a story about truck drivers and Bodaboda, people being affected a lot by infertility. Can your occupation be a health hazard?
Yes, it can. And what are we talking about here? We are talking about the scrotum. where the testicles are. Number one, the testicles have to be in the scrotum, because sometimes they may not be there. They may be actually be stuck somewhere in what we call the inguinal canals. That is also a reason of infertility. You find when you touch the scrotum, there is nothing there. You find these gentlemen have zero sperm, and when you do a scan and do other things, you find actually that either on one side or on both sides, the testicles are stuck there. So coming back to the work, professional hazard. Yes. Now, for example, when you talk about truck drivers, the ones who travel long distance, Mombasa, Kampala, or whatever it is, most of the time they are seated. That engine is there. And the heat from that engine, one thing we must remember is that the crown jewels, let's call them the crown jewels, they actually don't like heat. Actually, in the scrotum, the temperature is slightly lower than in the normal, in the other parts of the body. So when that temperature increases, for whatever reason, sitting for a very long time, then sitting plus the heat that is coming from the engines, and sometimes even the fumes that come from there, will have a knock-on effect on the production of sperm and the quality of sperm as well. We go a little bit further. Talk about gentlemen who use laptops. They take laptops and they put them on the laps. And we are working away. That heat from the fan also does affect, our crown jewels as well, as it were. Gentlemen who work in places whereby there's high temperature, in furnaces, for example, glass, whatever.
Glass making.
In bakeries as well, So basically the principle is the same. That heat can actually lead to poor production of sperm or even no production of sperm as well.
All right.
Amongst other things.
Another question. Hi, Frederick. Please ask Dr. what advice can he give to someone who had an abortion but now is struggling to get pregnant?
Abortion is a big issue. It's a big topic. I mentioned here, I think 2 weeks ago, that in Kenya today, these are statistics of about 2-3 years or 4-5 years ago from one of my senior colleagues at the university, Professor Karanja. About 450,000 illegal abortions are procured every year. 450,000.
Wow.
Yes, illegally. Well, we know that abortion is illegal unless there are issues whereby, the mother has an issue or the baby has an issue, then obviously it is allowed, in the Constitution. Now, when you talk about abortion and the possible consequences, again, it depends on what was done. Because when I find a patient who comes and says, I had a termination or I had this, the first thing I ask is, did you have medication or you had, what is called cleaning of the womb? Because sometimes that cleaning of the womb can be so vigorous such that we remove the lining completely, what you call the lining. And then later on, these ladies will be struggling actually to get pregnant. So the first thing I would like to ask that lady is, when was it done? What was done? How are her periods? Because this sort of give us an idea about what is going on. And then the other thing, if she's been struggling for a year, 2 years, her periods are very light, we may suggest that we do something called hysteroscopy, meaning we take her to theater and we put a tiny camera, about 5 millimeters in size. We put it inside the womb and have a look inside the womb, and then we can know whether the problem again is in the womb itself or there are other issues as well. So again, we come back to the diagnosis. We do her hormone levels, we do a scan, we check whether her tubes are fine, we check her husband, and then we can take her to theater. So there is a process by which we can help her.
That's Dr. Kireki, who is fertility specialist, talking to us. He has so many SMSs that are coming in. Unfortunately, we don't have a lot of time for that for today. He'll be coming back. Doctor, unaweza tueleza, where can we find you?
Thank you very much. I am found at 5th Avenue building. People always ask, where is this 5th Avenue?
Looks like a street.
It is a street. It is actually on Ngong Road, right by the road. It's called 5th Avenue building. Offices and on the 3rd floor, room 314. And I'm in the office on Tuesdays and Wednesdays from around 11 to around 5-6 in the evening. So you're welcome. All those who need assistance, God has given us the skills and the ability. We are here to help them.
All right, asante sana daktari. We are coming back with Benjamin Zulu. I've heard him, I've seen him. Today I'll be with him right here on Full Circle. My name is Frederick Mitiriri. We take a short break. We'll be coming back with more. I'll be giving you the quote of the day. In a short while, we'll be back.